Welcome to Book Buzz Reviews and Summaries. Have you ever felt like you were watching your life unfold from a distance, as if you were a spectator rather than a participant? Have you experienced moments where your reflection in the mirror seemed unfamiliar, your own voice sounded alien, or the world around you appeared distorted, dreamlike, or unreal? If these sensations resonate with you, you're not alone. These unsettling experiences, known as depersonalization and derealization, form the core of a condition that is as perplexing as it is underexplored: depersonalization disorder. In Feeling Unreal, Depersonalization Disorder, and the Loss of the Self, Dr. Daphne Simeon takes us on a groundbreaking journey into the depths of this enigmatic condition, unraveling its complexities, its impact, and its meaning in ways that will captivate both those who have lived it and those seeking to understand it. Let's begin by acknowledging a stark reality. Depersonalization is a condition that is often misunderstood, overlooked, and stigmatized. Despite affecting millions of people worldwide, it remains shrouded in mystery, frequently misdiagnosed or dismissed entirely. For those who suffer from it, this lack of recognition can feel like a double-edged sword. Not only do they grapple with the terrifying experience of feeling disconnected from their own identity and surroundings, but they also endure the isolating frustration of not being believed, validated, or understood. It is this profound sense of alienation that Dr. Simeon's book seeks to address, offering hope, clarity, and compassion to those searching for answers. What makes Feeling Unreal such a compelling and essential read is its unique combination of scientific rigor, personal narrative, and cultural insight. Dr. Simeon, a renowned psychiatrist and leading expert on depersonalization disorder, draws upon decades of clinical research, patient stories, and historical context to paint a comprehensive picture of a condition that defies easy categorization. At its heart, the book poses a fundamental question: what does it mean to lose one's sense of self? And in exploring this question, it invites us to re-examine some of our most deeply held assumptions about identity, consciousness, and what it means to be human. For the listener, the book opens a doorway into a world that is both fascinating and unsettling. It begins by describing the lived experience of depersonalization, a state where the familiar becomes foreign, where the self becomes fragmented, and where the boundary between reality and illusion seems to blur. Through vivid and poignant accounts, Dr. Simeon brings these experiences to life, giving voice to individuals who have struggled to articulate the inarticulable. You will hear stories of people who describe feeling as though they are living behind a glass wall, unable to reach out and touch the world around them, of those who feel like robots, going through the motions of daily life without any sense of connection or authenticity, and of individuals who question their very existence, wondering if they are real or merely figments of their own imagination. These narratives are not merely anecdotal. They serve as the foundation for a broader exploration of the neurobiological, psychological, and sociocultural factors that contribute to depersonalization disorder. Dr. Simeon delves into the brain science behind the condition, examining how disruptions in areas like the prefrontal cortex, amygdala, and temporal lobes can lead to the dissociative symptoms that characterize depersonalization. She explains how stress, trauma, and anxiety can act as triggers, setting off a cascade of physiological responses that leave individuals feeling disconnected and disoriented. And she explores the evolutionary purpose of dissociation, suggesting that what may seem like a malfunction is, in fact, a survival mechanism gone awry. But the brilliance of Feeling Unreal lies in its ability to move beyond the clinical and into the deeply human. Dr. Simeon does not merely dissect the disorder, she illuminates its emotional and existential dimensions. She asks us to consider what it means to live without a stable sense of self, to feel adrift in a world that no longer feels real. She examines the ripple effects of depersonalization on relationships, work, and daily life, showing how it can erode one's sense of agency, purpose, and connection. And she challenges us to think about the broader cultural context in which these experiences occur, exploring how modern life, with its relentless pace, technological distractions, and existential uncertainties, may be contributing to a growing epidemic of dissociation. As you listen to this book, you will not only gain a deeper understanding of depersonalization disorder, but also find yourself reflecting on your own sense of self and reality. What anchors you to your identity? How do you navigate the boundary between your inner world and the external world? And how do you make sense of the moments when that boundary begins to blur? These are questions that resonate far beyond the realm of psychiatry, touching on the very essence of what it means to be alive and aware. And yet, for all its intellectual depth, Feeling Unreal is also a profoundly hopeful book. Dr. Simeon offers practical strategies for coping with depersonalization, drawing on therapies like cognitive behavioral therapy, mindfulness, and grounding techniques. She highlights the importance of seeking professional help, building a support network, and finding ways to reconnect with the body and the present moment. And she emphasizes that recovery is possible, even for those who have felt lost in the grip of depersonalization for years. For those who have experienced depersonalization firsthand, this book is a lifeline, a validation of their experiences, and a roadmap to healing. For clinicians, researchers, and mental health professionals, it is an invaluable resource, shedding light on a condition that demands greater attention and understanding. And for anyone who has ever questioned the nature of reality or the stability of the self, it is a fascinating and thought-provoking journey into the uncharted territories of human consciousness. So, as you settle in to listen to Feeling Unreal, prepare to be challenged, enlightened, and deeply moved. Prepare to step into a world where the ordinary becomes extraordinary, where the boundaries of the self are questioned and redefined, and where the search for meaning takes on a new and urgent significance. This is not just a book about a disorder. It is a book about the human experience in all its fragility, complexity, and resilience. And as you turn each page, you may find yourself not only learning about depersonalization disorder, but also discovering new insights about yourself, your mind, and the nature of reality itself. Part 1 Summary of Feeling Unreal, Depersonalization Disorder, and the Loss of the Self by Daphne Simeon. Daphne Simeon's Feeling Unreal dives deeply into the phenomenon of depersonalization disorder, DPD, a perplexing and often misunderstood condition. Part 1 introduces readers to the disorder, its history, and the impact it has on individuals. The narrative interweaves clinical insights, personal stories, and research, providing a foundation for understanding the loss of self that defines depersonalization. Chapter 1. What is depersonalization disorder? The book opens by exploring the experience of depersonalization, a state in which individuals feel detached from their own body, emotions, or sense of reality. Simeon vividly describes the sensations, feeling like an observer of one's own life, as if trapped in a dream or separated by an invisible wall. She emphasizes that depersonalization is not merely a fleeting feeling, but, for those with DPD, a persistent, debilitating condition. Simeon shares real-life accounts to illustrate the disorder's impact. A young artist describes the world as muted, like watching life through a foggy lens. A mother talks about the guilt of feeling disconnected from her own child. These stories ground the abstract concept of depersonalization in relatable human experiences, drawing readers into the inner world of those who suffer from it. Chapter 2. A historical perspective on depersonalization. This chapter traces the history of depersonalization, showing how it has been documented for centuries. Simeon explains that while depersonalization was recognized in the writings of early philosophers and physicians, it wasn't formally studied until the 19th century. She introduces figures like Ludwig Binswanger and Maurice Merleau-Ponty, who explored the philosophical and psychological dimensions of selfhood and alienation. Simeon highlights how depersonalization has been overshadowed by other mental health conditions, often dismissed as a secondary symptom of anxiety or depression. This neglect, she argues, has left millions of sufferers feeling invalidated and without adequate support. Her passion for shedding light on the disorder is palpable, urging readers to see DPD as a standalone and significant condition. Chapter 3. The Neuroscience of Feeling Unreal. In this chapter, Simeon delves into the science behind depersonalization, explaining how brain mechanisms contribute to the experience of feeling unreal. She introduces readers to the concept of emotion dysregulation, where the brain's ability to process emotions becomes impaired. Simeon describes how the prefrontal cortex, the brain's rational control center, can override the amygdala, the seat of emotional response, in people with depersonalization. This leads to a numbing effect, where individuals feel emotionally switched off. She also explores the role of the default mode network, a brain system linked to self-awareness, and how its dysfunction may explain the loss of a cohesive sense of self. Through accessible language and vivid metaphors, Simeon makes complex neuroscience understandable. She compares the brain's response to depersonalization to a circuit breaker flipping off during a power surge, a survival mechanism designed to protect the mind from overwhelming stress. Chapter 4. Triggers and Causes. What causes someone to feel unreal? This chapter explores the various triggers and underlying factors that contribute to depersonalization. Simeon identifies trauma, severe stress, and anxiety as common catalysts, explaining that depersonalization often arises as a coping mechanism in response to emotional overload. She highlights the connection between DPD and other mental health disorders, such as post-traumatic stress disorder, PTSD, depression, and panic disorder. However, Simeon is careful to note that depersonalization is not merely a symptom of these conditions. It can exist independently. The chapter also touches on the role of substance use. Psychedelics, cannabis, and even alcohol can sometimes trigger depersonalization episodes, particularly in individuals predisposed to the condition. Simeon shares the story of a college student who experienced persistent depersonalization after a single bad trip, illustrating how the disorder can be sudden and life-altering. Chapter 5. The Emotional Fallout of Feeling Unreal. This chapter examines the emotional toll of depersonalization on those who experience it. Simeon explains how the disorder can lead to feelings of isolation, despair, and hopelessness. Many sufferers describe a profound sense of alienation, not just from others, but from themselves. She shares heartbreaking stories of individuals struggling to maintain relationships, careers, and daily routines while feeling disconnected from their own existence. One man describes his marriage as watching a movie of someone else's life, while another woman speaks of the unbearable guilt of feeling indifferent toward her newborn child. Simeon explores how this emotional disconnect can lead to a vicious cycle. The more people try to snap out of it, the more frustrated and anxious they become, which only deepens their depersonalization. This cycle, she argues, underscores the importance of understanding and addressing the disorder with compassion. Chapter 6. The Philosophical and Existential Dimensions. In one of the book's most thought-provoking chapters, Simeon explores the philosophical implications of depersonalization. What does it mean to lose one's sense of self? How do we define our identity when we feel detached from our emotions, memories, and experiences? Simeon draws on existential philosophy to frame depersonalization as a crisis of being. She references thinkers like Soren Kierkegaard and Jean-Paul Sartre, who grappled with questions of identity, meaning, and alienation. Through this lens, depersonalization becomes not just a psychological condition but a profound challenge to the human experience of selfhood. The chapter also explores how depersonalization can spark a search for meaning. Some individuals find solace in spirituality or mindfulness practices, using their detachment as an opportunity for self-reflection and growth. Simeon suggests that while depersonalization is deeply painful, it can also be a gateway to profound self-discovery. Chapter 7. The Lived Experience. Voices of Those Who Feel Unreal. This final chapter of Part 1 is devoted to the personal stories of individuals living with depersonalization disorder. Simeon shares their voices in raw and unfiltered detail, creating a powerful tapestry of human resilience and struggle. One woman describes the sensation of looking in the mirror and not recognizing the face staring back at her. Another man recounts the fear of losing control, feeling as though his mind and body are disconnected. These stories are both heartbreaking and illuminating, offering readers a glimpse into the day-to-day reality of living with DPD. Simeon emphasizes the importance of validation and community for those with depersonalization. Many sufferers feel dismissed or misunderstood by friends, family, and even healthcare providers. By sharing these stories, she aims to give a voice to the voiceless and foster greater awareness and empathy for the condition.
Part 2.
In Part 2 of Feeling Unreal, Daphne Simeon shifts from exploring the nature and impact of depersonalization disorder, DPD, to practical solutions, therapeutic approaches, and pathways to recovery. While Part 1 laid the groundwork for understanding the disorder, Part 2 provides hope and guidance for managing it. Through a combination of scientific research, therapeutic insights, and personal accounts, Simeon delivers a roadmap for individuals seeking to reclaim their sense of self. Chapter 8: Diagnosis and Misdiagnosis. Simeon begins Part 2 by discussing the challenges of diagnosing depersonalization disorder. Since the symptoms overlap with other mental health conditions such as anxiety, depression, and PTSD, DPD is often misdiagnosed or overlooked. Simeon underscores the importance of clinicians recognizing depersonalization as a distinct condition rather than dismissing it as a secondary symptom. She shares stories of individuals who endured years of misdiagnosis, often feeling dismissed or misunderstood by medical professionals. One patient recounts being told that their experience of feeling unreal was simply a side effect of stress, while another was prescribed medications for conditions they didn't have. Simeon calls for increased awareness and training among mental health practitioners to ensure DPD is accurately identified and treated. Chapter 9: The Role of Therapy in Healing. This chapter delves into the therapeutic approaches that can help individuals with depersonalization disorder. Simeon highlights several evidence-based therapies, including cognitive behavioral therapy. CBT helps patients identify and challenge the thought patterns that perpetuate their depersonalization. Simeon explains how catastrophizing thoughts, such as "I will never feel normal again," can deepen the sense of detachment. Through CBT, individuals learn to reframe these thoughts and reduce their emotional impact. Mindfulness and grounding techniques. Simeon introduces readers to practices that anchor individuals in the present moment, such as focusing on physical sensations or engaging in deep breathing exercises. These techniques help counteract the out-of-body sensations of depersonalization. Trauma-focused therapies. For individuals whose depersonalization stems from trauma, therapies like eye movement desensitization and reprocessing, EMDR, can address the root cause. Simeon shares the story of a patient who, after processing a traumatic event through EMDR, experienced significant relief from depersonalization symptoms. Simeon emphasizes that while therapy is not a quick fix, it offers a pathway to gradual recovery. She encourages readers to seek therapists who are knowledgeable about depersonalization and willing to tailor treatments to their specific needs. Chapter 10: The Role of Medications. In this chapter, Simeon explores the role of medications in managing depersonalization disorder. While there is no single drug specifically approved for DPD, certain medications can help alleviate symptoms by addressing underlying issues such as anxiety, depression, or mood instability. Selective serotonin reuptake inhibitors, SSRIs, commonly used to treat anxiety and depression. SSRIs can help reduce the emotional numbness and distress associated with depersonalization. Lamotrigine. Simeon highlights promising research on lamotrigine, an anticonvulsant that has shown efficacy in reducing depersonalization symptoms in some patients. Anti-anxiety medications. Simeon cautions against the long-term use of benzodiazepines, as they can lead to dependency, but acknowledges their short-term benefits for acute anxiety. She stresses that medications should be used in conjunction with therapy and lifestyle changes, rather than as a standalone solution. Simeon provides a balanced perspective, acknowledging that while medications can be helpful, they are not a cure-all for depersonalization. Chapter 11: Lifestyle Changes and Self-Help Strategies. In this chapter, Simeon shifts focus to the role of lifestyle factors in managing depersonalization. She outlines practical strategies that individuals can incorporate into their daily lives to reduce symptoms and regain a sense of self. Stress management. Chronic stress is a key trigger for depersonalization. Simeon recommends stress reduction techniques such as yoga, meditation, and exercise, which can help regulate the nervous system. Sleep hygiene. Poor sleep can exacerbate feelings of detachment. Simeon emphasizes the importance of maintaining a consistent sleep schedule and creating a relaxing bedtime routine. Diet and nutrition. While not a cure, a balanced diet can support overall mental health. Simeon discusses the potential benefits of reducing caffeine and sugar, which can increase anxiety and worsen depersonalization. Social connection. Isolation can deepen the sense of detachment. Simeon encourages individuals to maintain social connections, even when it feels challenging, as these interactions can help ground them in reality. This chapter also includes testimonials from individuals who found relief through lifestyle changes. Their stories provide inspiration and practical examples of how small adjustments can make a significant difference. Chapter 12: The Path to Recovery. Simeon dedicates this chapter to the process of recovery, emphasizing that while depersonalization disorder can feel permanent, many individuals do experience significant improvement or complete remission. She acknowledges that recovery is not linear and requires patience, persistence, and self-compassion. She highlights the importance of setting realistic goals and celebrating small victories along the way. For example, one patient shares how they started with simple grounding exercises and gradually built up to engaging in social activities they had once avoided. Simeon stresses that recovery is about progress, not perfection. The chapter also addresses the fear of relapse, reassuring readers that occasional setbacks are a normal part of the healing process. Simeon provides strategies for managing relapses, such as revisiting grounding techniques and seeking support from trusted individuals or therapists. Chapter 13: Finding Meaning in the Journey. In the final chapter, Simeon explores how some individuals find meaning and growth through their experience with depersonalization. While the disorder is undeniably challenging, it can also serve as a catalyst for self-discovery and personal transformation. Simeon shares stories of individuals who use their experiences to deepen their understanding of themselves and others. Some found solace in creative pursuits, such as writing, art, or music, while others turned to spirituality or mindfulness practices. She encourages readers to view their journey with depersonalization as an opportunity to cultivate resilience and self-awareness. While the path is not easy, it can lead to a richer and more authentic sense of self. Thanks for listening. Please like, subscribe, and click the bell icon to get new video updates.